natural journey unfold, let our products naturally assist you. SALOME, your journey matters.
Available at pharmacies nationwide.
Now, women globally face daily challenges before, during, and after their period. So it's vital that we get a little assistance when choosing the right products to use during the menstruation cycle. And that can go a long way. And joining us in studio today to discuss menstrual pain in particular is general practitioner Dr. Heidi Frere. Dr. Frere, thank you so much for joining us. Very good morning. How are you?
Fine, thank you. Thanks for having me.
I think this is a vitally important conversation for partners and fathers in particular to be having. So I'm hoping you're going to help to educate me in my journey as well. But I'm going to start with maybe kind of the basis of this discussion. I think, as I understand it, women experience one of the two. It's the difference between pain and cramps during the menstruation period.
A lot of people probably use the term synonymously. The medical term for pain during menstruation is called dysmenorrhea. Pain can be localized to either the lower back, the pelvic area, or radiating down into the thighs or legs. The cramps is a bit of a spasmodic, sort of coming and going kind of pain that's experienced directly from the uterus contracting.
So maybe a great way, a lens to look through is to understand what is actually happening within that process. So what are the causes of the pain and what is actually happening to your body during the menstruation period?
Leading up to the week into the period is typically where women would experience what we call premenstrual syndrome or premenstrual tension. And the problem with a lot of women is that they sometimes have a more dramatic decrease in the amount of progesterone. So progesterone is really our calming hormone. It helps us with bloating, it helps us with sleep, it helps us with anxiety and irritability. It even works as a natural diuretic. So when we don't have enough of it, that premenstrual week can be experienced with really, really severe symptoms affecting relationships, affecting work, really becoming very, very irritable, moody.
I mean, in some cases, debilitating. And I know and understand that everyone is different, and this is going to be a different experience or different menstruation experience for each individual. But why do some people suffer pain or more pain than others?
It would really be because some of them are inherently just more deficient in that level of that hormone called progesterone. That's number one. Number two is that there may have been a family history, but it also has been linked to the amount of stress that a woman experiences as well. That also seems to have a negative impact. Just interestingly, the hormone that is produced by the uterus called prostaglandins is the one that causes the uterine contractions during a period. And symptoms can range from nausea, vomiting, just really, really debilitating symptoms. And you can imagine that scholars may need to spend a day or two out of school. It can affect young women in the workplace. It can really be disruptive to a lot of women.
Maybe feeding off that, can you give us some insight into the difference between primary pain and secondary pain? What are we talking about here?
The primary dysmenorrhea is typically what a woman or young girl would experience at the outset of her first menstruation thereon. Secondary dysmenorrhea typically occurs much later, and there's often a physical cause for that secondary dysmenorrhea. And that's where the role of a doctor comes in, the role of a gynecologist comes in, to really ensure that there isn't any underlying disease or pathology causing that dysmenorrhea. One of the things, endometriosis, is endometrial tissue, which is now sitting not where it's meant to be within the uterus, but outside of the uterus, be it somewhere else in the pelvis, be it attached to bowel. It causes adhesions. It responds to hormones exactly the same way endometrial tissue within the uterus responds. So it cycles, it bleeds, it causes a considerable amount of pain. It can occur in the tubes, it can affect fertility. You touched on something else called fibroids. Fibroids are benign growths that occur within the uterine wall. They can range in size from a few millimeters to really massive growths. They're not cancerous, but they can make a menstrual month a literal nightmare.
Unbearable.
Because there are heavier bleeds, unbearable. There's excessive pain, lots of bleeding as well. And then the third thing was PID, or pelvic inflammatory disease. This is typically caused by a sexually transmitted disease and requires diagnosis and treatment, often with antibiotics. Long-term, if left untreated, it can cause considerable amount of scarring within the fallopian tubes and really can also affect fertility.
Well, you've just touched on it yourself, but what are some of the common treatment options when we start moving into the more serious space? When you cover these kinds of conditions, how do we go about that treatment plan?
So I think first and foremost, it's really to try and determine whether someone is experiencing mild symptoms, moderate or severe. I often ask my patients to keep a calendar and to try and grade their pain out of 10. 1 out of 10 being minimal, 10 out of 10 being extreme. And if we can gauge from that just how severe their symptoms are, it then warrants investigation. Also, just how much of your menstrual cycle is your life being impacted by. And that should also be a good indication for moms, for dads, for young women to just seek out treatment. So knowing when the menstrual cycle is, knowing when that PMS week is going to be very enlightening. And so you can start planning around that. Reduce your stress levels at that time. Do less intensive exercises, yoga, exercises like that are preferred. And then more medical treatments would be analgesia, so paracetamols, anti-inflammatories, managing those progesterone levels, even with some natural herbal products, can be a great option.
It is fantastic to have guests like yourself to be able to tap into, certainly from a father's perspective. I found this really enlightening. Thank you so much, Doctor. We really do appreciate your time and your insights.
Thank you so much for having me.
With SALOME, not only does your journey matter, but giving you the best advice from the experts themselves makes your journey that much easier.
On a monthly basis, all of us powerful, fierce women deal with our menstrual cycle. But why let it affect our lives?
Anywhere I go, anywhere I be.
As your natural journey unfolds, let our products naturally assist you. Live your full unfiltered life with the SALOME range for PMS, menstrual pain, and heavy menstrual bleeding. SALOME, your journey matters.
Available at pharmacies nationwide.